Hello, hello, and welcome to another edition, another episode of the Ask Dr. Darwin Show. Ask Dr. Darwin Show. I'm Dr. Darwin Hayes, known as the new dentist coach. I've been helping new dentists, those students that are pre-dental, those that are dental students, those that are residents, and those that are recent grads with professional development. My goal and purpose in doing this show and also having content that you're looking at right now is to help as many new dentists as possible. As many new dentists as possible. In today's episode, we're actually going to be talking to a recent grad who actually just finished up a residency, a general practice residency, general dentistry residency, and she has aspirations in becoming a board certified pediatric dentist. And actually, this was one of my residents who's going to be going into PEDO, and I thought it would be a great idea for you guys to get the inside scoop on the PEDO application process and most specifically the interview process. So we're going to have someone come join us on the show and actually give us her perspective on her process, on how she basically how she got into pediatric dentistry. I'm gonna let her tell her story, but it's a phenomenal story. And she's going to have some pearls and some actual tips for those of you that are considering applying into to PEDO. All right, so let's get her on the call now.
Hello?
Hey, Dr. Gill, Dr. Hayes, how you doing?
Good. How are you?
I'm good. So thanks again for taking out some time to talk about your experience in PEDO and applying to PEDO. I'm actually recording a call, so maybe in the future, if you've got some mentees or people that are asking you about PEDO, you can refer them to the call and also to the show, and then we'll have it also for other new dentists that are looking to apply into PEDO. So what I wanted to do is just to kind of briefly have you introduce yourself, and then we'll go into the couple of questions about why you decided to do PEDO and have you talk a little bit about your process via the outline that we've kind of put together. Okay, how's that sound?
Yeah, sure, sounds good.
Okay.
So I'm Dr. Gill. I graduated from the University of British Columbia in Vancouver, Canada, and I came out here to do a GPR at Bronx, Lebanon 1 year ago now, and I'm here applied to pediatric dentistry, and I'll be starting at the University of Washington in Seattle this come June.
That sounds great. So why PEDO? What about PEDO made you want to become a pediatric dentist and make that be your focus for your career?
I decided on pediatric dentistry a lot because I used to treat special needs children before starting dentistry, and I know that pediatric dentistry, you have a bit of a focus there, and also you get to treat patients for a long time. So you get to develop bonds with the child and the family from childhood and all throughout their teens, and treat patients who have behavioral issues who would otherwise have difficulty being seen in a regular dental office, and I just felt like I wanted to treat that population solely rather than treating adults as well.
That sounds good. So kind of walk us through your process. Would you agree that starting early in the process as far as your applications and everything is good, bad, and how did you approach it?
Yeah, so I'd say starting early is very important just because there are a lot of steps, and each step can take some time to complete, especially when you're asking for reference letters. So you want to make sure that you ask for your reference letters far in advance so that your references don't feel rushed, and that way you'll get a better reference letter. And then also just for gathering some of the documents, when you're gathering your NDEP scores, your NDBE scores, your transcripts and whatnot, it can take a while. Sometimes you might run into issues. You want to make sure that, especially when you have to wait for either documents to come in the mail that might take 3 to 4 weeks, you want to make sure you start really early looking at those, and also looking at which schools you want to be applying to, and start inquiring with other pediatric residents who maybe have just applied the previous cycle and know a little bit about each program. So the earlier you start, the more information you get, the more successful of a application process you'll have.
Good. Okay. What about the application? What about what are some things that you would say about how you prepared for the application? I know you mentioned start early. You mentioned make sure you have enough. You're giving enough time for your references to have time to put together a letter for you and be able to send it out. And that also that you need time to gather your documents, your scores, and things like that. What else? What about your essay or anything? Things like that.
Yeah, so you want to make sure that you have a very well articulated essay that specifies why you specifically want to pursue the specialty, and ensure that the letter is specific to the experiences that you've had throughout. So you want to make sure that you highlight your volunteer experiences, your work experiences that have made you decide that you want to pursue this particular specialty. You'll be mentioning the work and volunteer experiences on your CV as well, but the more that you reinforce them, so you talk about them in your essay as well, the more the program directors will remember that, and then that way it'll come up during your interview as well. So you want to make sure if you had, for instance, for myself, I worked a lot with special needs children. That was one of the focuses of my essay because I wanted them to ask me about that when I went to an interview. And so if I had mentioned it on my CV, I mentioned it on my essay, then that kind of, they get an idea of why I specifically want to pursue pediatric dentistry. So you want to have a specific reason. Don't use a generic, I want to do a specialty because I want to be better in the field or something like that. You want to have a very unique reason for yourself, and that is highlighted through what you've done in the past. That way they'll remember you, and you'll sign up with the rest of the applicants.
Sounds good. So basically, on the essay, really have a focus. Make sure that it's a unique focus, and whatever you put in the essay, and whatever you put in your you have in your CV. Would you agree it's fair game? That's things that may come up in your interview.
Oh, definitely. Yeah, sometimes they actually bring your CV to the interview, and they'll particularly ask you questions about your CV. So you want to make sure. I've also heard that sometimes they'll bring your CV, and if you have any typos or any dates that don't make sense, they'll ask you about those. So you want to make sure your CV is perfect, and they will definitely ask you questions about your CV, maybe just right in front of you and ask you, how was this experience, or how was that, or, what was this hobby that you mentioned. So you definitely want to make sure that your CV is accurate, and that it actually is a true testament to who you are.
Good. So don't just write down stuff on your CV and not be able to explain it.
Yeah, they'll ask you. Yeah. I definitely had an interview where they had my CV right in front of me and they asked me questions. So you really want to make sure you know it well.
Oh wow! So that's a good tip. That's a great great tip as far as knowing what they may do in the interview. Having your CV in front of you and just kind of going through item by item and having you kind of describe more in detail about some of the things that are actually on your CV. So that's a great tip. That's good to know.
Yeah, definitely.
What about well, tell us a little bit. Well, tell us how many programs you applied to.
I think I applied to about 17 programs or so.
About 17.
And then
17 programs.
Yeah, about that. Yeah, 17. And then I received about 13 interviews, and I went to 11.
17 programs, 13 interviews, and actually went to 11 of those. So, wow, that's remarkable. That was well done. Yeah, I kind of remember us having to sign you out and approve a couple of educational leaves and some extra ones just to get you the opportunity to go visit those programs. So, yeah, I kind of remember that now. So that's great. Yeah. So, how did you make your decision as to which programs you were selecting for PEDO? Did it have anything to do with where you're from? Did it have anything to do with recommendations from maybe faculty members? Like, how did you come up with your list of 17?
Yeah, so my list was dependent on sort of, well, for one thing, I'm Canadian, so there's some programs that I can't apply to right from the beginning just because some programs don't accept Canadians. So that's how I started my search. And then beyond that, it was dependent on if the program was academic or not. So I'm interested in a program that has like more of a didactic curriculum. And so for me, I would look at the program and I would see whether or not it can be, I was okay if it was a hospital-based program and not a master's-based program. I just wanted to make sure that it had enough didactic focus because not all programs are made equal. And then also, yeah, based on the recommendations. So the GPR that we're at right now, there is a pediatric program there. So I asked the pediatric residents who had just applied about what programs they had heard good things about. And then I also reached out to some of my faculty members from my university in Canada and asked them if they knew of any particular programs, and also the ones they went to, if they would recommend that I went there. And that way, I also did that just so that if I did apply to these programs, then during the interview I'd be able to mention their names, which I did do. So you'd be able to say, oh, do you know anyone who graduated from this program? You'd say, oh yeah, I knew, Dr. Gardner, she graduated in 1995 or something like that. It just makes it a little bit more personal for why you're applying to that program during the interview. So that's kind of how I made my list.
All right, yeah. So you kind of based it on your own needs. Some people will probably have maybe more of a maybe if it's more of a research-based residency or if it's more of a clinical-based residency, but yours was based on more of the curriculum based on the didactics in the curriculum. So that's good. Recommendations from that's key. I like this other one you just mentioned. Getting recommendations from other PEDO residents, people that have applied to PEDO. Yeah. Maybe went on some interviews and had some background information for you about different programs across the country. That's probably big. That's a nice one. I didn't even think about that. And
it's really important.
Mm-hmm. Okay. So you got your 17 based on that, and then you started having interviews. Tell us a little bit about how you prepared for your interview. Like what were some of the things that you well, just first, let's talk about how you prepared for the interview, because that in itself can be kind of daunting for a lot of folks.
Yeah, so preparing for the interview, I asked the existing PEDO residents who had just applied about some of the questions that they received. So I asked them, what kind of questions came up, and I made a little bit of a list of the questions, and then I actually typed up my responses to some of the questions that I expected to get. So you're going to have questions like why pediatric dentistry or whatever specialty you're applying to, and how did you make this decision? When did you make this decision? Why didn't you apply right after dental school? That's something that they'll ask you as well. So once I kind of had my questions list and I wrote my responses and I rehearsed a little bit as I was at home before the interviews themselves, and then I also researched each particular interview I was going to. So you want to look at which program you're applying to. You want to know about their program in and out, because you make sure that while you're asking the interview questions and that while you're asking them questions, you don't ask something that's not applicable to their program. So at the end of the interview, they'll ask you, do you have any questions? And if you ask them a question that is not relevant to the program, then it's just not good for you. So you want to make sure you're asking relevant questions and you know about the program very thoroughly.
Right. Yeah, I tell people and people that I've been coaching all the time that, prior to the interview, you've got to do your research or dig a little deeper in the research that you've already done about the program. Find out about the mission, the objectives, what their purpose is. If you can sift through and find that information, whether it's online or whether it's from others that have interviewed or actually residents that are there currently. So that's so key, because you want to make sure that your answers and your presentation is specifically for that program. So that's key. So tell us a little bit about the interview. What was the interview like? What kind of questions did you get? Like, or what do how did you prepare for the interview questions? And what type of questions did you get?
So there's two different types of interviews that I had. Some interviews are panel interviews where you'd be just you yourself, and then there'd be maybe 3 to 4 of the interviewees who might be a program director, an attending, an existing resident, and whatnot. So there's those types of interviews, and then there's also the multiple mini interviews where you go room to room to room. So I've had a few of those interviews where I had 7 to 10 different interviews, and each of them was a separate room with one interviewer, and they asked you either a regular question or a role play, or they'd ask you about a case and whatnot. And so you kind of have to be prepared for both interview styles, because they vary based on the program and how they'd like to interview. And then some of the questions that they'll ask you, they'll want to get to know your personality, because they'll be spending a lot of time with you. So you want to make sure that you talk about your hobbies and your adventures and things like that, because they want to know you aside from your academic background and your clinical background. They just want to know who are you, because most residency programs only have 5 to 6 residents. So they really want to make sure that you're going to mesh well with the other residents and also with them. And so you want to make sure that you talk about your likes and your interests, and also so that you can get engaged you can fit into like the particular city that you're moving to. So if you're moving to Colorado and you don't like the outdoors or hiking, then maybe that's not a good program for you geographically. So you want to make sure you talk about those things as well. The other kind of questions I got are, they'll ask you what you're looking for out of a specialty program. So you want to mention things that are relevant to them. So you don't want to say that you're looking for a program that has a lot of technology if you're applying to a program that is dated in that. You want to make sure you're saying what you telling them that you want out of a specialty program is what they have.
Okay.
So you want to make it short. So if you're talking about one, you want to treat an underserved population. I want to treat medically compromised patients. I want to treat this type of people. Then you want to make sure that that's what their specialty program actually offers, so that they know that you're applying to the right program. You're not just applying to a program that offers them not what you want.
Right.
So you want to make sure you do that.
Right.
And other questions I got were, what does it mean to be a leader? That came up a few times. You want to make sure you have a good answer for that. And then when you're answering that question about what it means to be a leader, you want to talk about why you are a good leader. So you throw in examples of what you've done in the past that makes you a good leader. They'll ask you how do you achieve balance in your life. So depending on, you want to talk about how because they want to know that you're going to be able to manage the patient flow and also have a life outside of residency program and not be overly stressed. So you want to talk about what you do to cope with stress and time management, so that they know that you're going to be able to do them.
Okay.
They'll also ask you about your strengths and weaknesses. Like always, you want to make sure that your weakness is also a strength or something that you know how to improve on. Or you can make sure that you mention your weakness is something that you've already started improving on. So my weakness, for instance, I would say is that I don't spend a lot of time doing reflection. And so then I would talk about, I'm trying to get better at that, so that when I, have a day at clinic and I feel like I didn't do something right or I could have done something better, then I'll think about it and I think about how it could improve. So then at least when I'm in that same situation again, I know how to approach it better. So you want to make sure that your weakness is something that you at least recognize and acknowledge and have started to work towards, or your weakness is sort of a secret strength.
Yeah, that's a great comment. That's a great tip, because I know lots of times people get that question and they may know that it's coming, but really don't know how to answer it. Strengths and weaknesses. I know some people will say, "Oh yeah, my strength is I'm a hard worker." Well, that's everybody on the planet who's applying to PEDO. That's all 10,000 people. Exactly. So you're right. And then the whole thing about the weakness, actually having a statement or a response that's based off of you already working. Well, first of all, already having enough self-reflection to be able to self-assess what's happening, and then being able to say, all right, I'm moving towards this on my weakness, and this is what I'm doing to address it. I think an answer like that is great, because it shows responsibility, it shows maturity, and it also says, like you said, it shows the ability to self-reflect and continue to move forward. So that's great. What other questions did you get doing your interviews?
You'll get questions about what is an example of when you had to overcome an adversity or you experienced an ethical dilemma. How did you manage it? You'll also get questions about, sometimes tell me an interesting case, or tell me a time where you had a tough day in clinic and what was that like, and things like that. So you want to make sure you're really prepared for those questions, because again, they want to know about how your stress management is.
Right.
And so especially with the questions about adversity and ethical dilemmas, those come up a lot because they want to know how you've managed those situations, and also because sometimes you're not anticipating a question like that. They want to know how you can sort of think on the spot, because a lot of the residency is going to be at that kind of thinking. So they want to make sure that you're prepared for that. Right.
Yeah, that's key. That's key. It's funny that you mentioned about ethical dilemmas. I know one of the things that we had this year in the program, we kind of tweaked it a little bit, and we had a whole ethics course, a dental ethics course, and professionalism. But also on the new ADAT, there's a section on that that they try to measure, which it's kind of hard to do, kind of measure it in an exam, but it may give program directors some insight. But really, you just ethics, I think, is a personal matter that has ramifications, deeper as far as professionally. But that's a good question to know, that may be asked, and be able to prepare for it. So,
definitely.
Okay. Did they ask you any other questions that you remember?
One thing that, just some examples of questions, they're going to ask you if you have any questions for the program. So, some examples of some questions that you should have ready to ask them, or that I had ready to ask them was, for instance, because I'm applying to pediatric dentistry, I asked, what is the level of experience with conscious sedation and IV sedation? Do you get experience administering sedation? On average, how many cases? So, things like that. But these questions might get answered during your tour. So generally, the interview is either 2 days or it's a long day, and you'll have an opportunity to interview with the existing residents of the program. You get a tour, and they'll go over a lot of those things. But if they haven't been asked, then you want to make sure you find out that, because that way you can compare the programs that you're applying to. So you want to know if one program only does 40 cases of OR sedation and then another program does 140. Do you want to be doing that many, or do you like that there is that experience and whatnot? So you want to make sure you ask questions like that. Specifically if you're applying to pediatric dentistry. Okay. You also want to ask about the didactics. So you want to ask them what their lecture scheduling is like. Who are the lectures from? Are the lectures just from each other? Because you want to make sure that the program directors are not, in some programs, the lectures are by the residents themselves through research and whatnot. So if you're okay with that, that's fine. Or you want to ask if the lectures are maybe supplemented with lectures from each other, but also lectures from attendees, and in the format of a journal club. And you kind of want to have a base of that being prepared. Mm-hmm. You also want to ask about the patient base, if that matters to you. So what's the age group of the patients? And if you're interested in treating children with special needs, you want to make sure that you ask whether or not they treat children with special needs and how many. And then also, a really good question to ask for any program in any specialty is if there are any plans that are being implemented to change the program that would affect incoming residents. So you want to know if maybe they had a funding cut, or the programs are very honest in this, and I had a program say that they did have a funding cut and that they were going to be restructuring some of the factors in the program, although it wouldn't affect the resident experience too much and whatnot. So you can ask that question just to get a gauge of if there's going to be any changes that are going to be different from when you're in the program itself.
Oh, wow. So you had your list ready.
Mm-hmm. Oh, yeah, I had a list, yeah. Because sometimes some of your questions aren't relevant anymore because they've come up in the tour, and then you're sitting there and they're asking for a question, and they've answered everything. They've had a day talking about all this information, so you want to make sure that you don't ask a question that's already been answered. So you need to have a lot in the back. Some people bring in a list, and that's okay too. You can bring in, it looks quite professional as well, to bring in a folder that has a list of questions, and you can kind of read that through and let them know that, okay, you know what, these questions were answered, and these are the questions that still have left. So you can even do that. I saw some people do that. It just depends how you want to approach it. But that's a good idea.
Yeah, that's fun. I'm glad you mentioned that, because I'll ask candidates sometimes when we do interviews if they have questions, and they're like, oh, can I go to my folder and bring out my list? I'm like, yeah, of course. I mean, that's what you're here. You have questions. Bring your questions. I have questions. The interviewers and the admissions committees has their folders and stuff out. You can have your folder out too, so that when you're asking questions, you're taking notes. Yeah, of course. I mean, I encourage that, but I'm looking for people who are actually taking notes, that are engaged and that are asking questions and have their questions ready. Someone who's just sitting there and just kind of going through the questions and kind of looking off to the side. I don't know. I don't know if I may be questioning their preparation, or maybe that's just how they present. But hey, it's nothing wrong with having your notepad, your questions ready to roll as a candidate to fire away when the opportunity comes up. So yeah, I want you to be interested in the program. I want you to show that in your personality and your presentation. So yeah, having those questions ready to rock and roll is fair game, I think.
Yeah, definitely.
That's good.
Yeah.
That's good. I'm trying to think some other things. Now, with your interview, were there any questions about your training and why you did a GPR, or did it come up as to your preparation for PEDO? How you felt you were more prepared for PEDO based on any types of experiences? And I guess I'm leading with also the notion of why you think doing a GPR or some type of training or working before maybe specialty training is important or beneficial.
Yeah, definitely. So I feel like program directors want to know that you are certain about your decision to specialize in the field. And then doing your residency shows that you spent additional time to explore your options and decide, as opposed to applying to a specialty program right after dental school, where you don't have a lot of exposure experience in any specialty field. So you might have done 2 crowns in dental school, and then you say you want to apply to cross. Right. So they want to know that you actually have experience and that you know what that specialty field is like. So whether you have real-world experience, you worked in private practice that treated a lot of children, for instance, and that can be your sort of apply as to why you want to apply to pediatric dentistry, because you treated a lot of children, not because you treated 2 pediatric children in 2 well-behaved kids in dental school. Well, you're not ready for pediatric dentistry if that's what you think it's going to be like. So they want to know that you actually have a realistic picture of what the field is going to be like. Right. And then doing a GPR is good because most GPRs are serving a population that is underserved, is medically compromised, and you're treating a heavy patient flow with a lot of patients per day. So that kind of shows that you're ready for a fast-paced specialty program that treats this population. So that's something that I mentioned a few times because program directors ask me, do you think that you're ready for a pediatric program that treats 10 to 12 patients a day or whatever? And I say, yeah, because I'm doing that right now, and I'm treating a population that's the same, and I'm dealing with the similar issues and time management and whatnot. So the fact that you actually experience that gives you a little bit more qualification as opposed to a dental student who's only 3 to 2 patients a day. So you want to make sure that you're ready for that. And then also you want to show that you're teachable as well, because some programs don't like the fact that you've done training outside dental school because they think that sometimes a lot of residents will gain a lot of confidence from that and they're less teachable. You want to make sure that you show that you've gained experience, but you're still teachable and that you're still willing to learn. Nobody wants a resident who thinks that they know everything already just because they did a 1-year GPR, because you don't. You want to make sure that you have the experience and that you have the clinical training and you gain the confidence, but also that you know that you're willing to learn still and that you're entering a new residency program where you're expected to be able to keep up with their rules and to learn and figure out how they do things. So they want to make sure that residents are teachable is the biggest thing. So
wow.
Make sure that you mention that.
Wow, that's an important point. Doing a GPR or AGD program shows that you are teachable, coachable, and still willing to learn as relates to going into specialty. I think that is so key outside of the other reasons why you should do a general dentistry residency, even if you're not going into specialty, but more so if you are, just because of the things, like you said, those exposures, the increase of exposures and the number of patients that you're going to be learning how to manage. Again, you're right. Two patients a day in dental school is nothing like residency, depending on where you go, where you're seeing 8 to 12 patients a day, which is going to be probably your normal flow in residency as a specialist. So, oh my goodness, that's big. That's big. I thought I didn't even think about it like that, and that's so true. Showing that you're teachable, coachable, and still willing to learn. That's big. Okay.
Yeah.
Good. Thanks for that. Now, trying to think what else as we wrap this up here. So,
I'd say one more thing I'd like to add is that you want to make sure that you have a separate question list, not only for the interviewers, but also for the residents, because you actually spend more time with the existing residents of the program than you do with the interviewers, because your interview might be half an hour, but your actual time with the existing residents will be either the entire day, the day before, 9 to 5, or it might be, 9 to 3 the day of. So you want to make sure that all that time that you're spending with the residents, they're interviewing you. So you want to make sure that you have questions ready for them, because they're going to, right after the interview, they're going to talk to their program directors and they're going to say, I didn't like that Dr. Gill said this, but she wasn't prepared in this, blah, blah. And so they're really going to take that into consideration, because the program directors want to know that you're going to mesh well with the existing residents, because they're the ones who are going to be spending time with you and you are expected to work together. So you want to make sure that you have questions for them, and you can ask them also questions that you feel you would otherwise feel uncomfortable asking the interviewers like. So if you want to ask about what the on-call experience is like, how often you get calls, what type of procedures you're doing on call, up to what age group you're going to be treating patients on call, if that's relevant to you. For me, it is pediatric dentistry. And are you required to be on-site or off-site? Those are questions that you might not want to ask the interviewers, because you don't want to seem like you're asking because they're lazy, but you want to make sure that you're asking the residents because you want to know what You want to have a realistic picture of what your call is going to be like. So if you're going to be on call every 3 nights, let's say, you want to make sure that you know that before you start the program, and that might not be something that you're interested in. So you can ask the residents questions like that. You can also ask the residents if there's any electives or if there's any opportunity to do any side projects during the program. And you can ask them questions like, where do they live? How do they get around the city? Is there any off-site clinics that they go to? Do they hang out? Are they friendly? Are they friends? You want to make sure you're watching that during the interview process as well, because if the residents look unhappy, that's usually a really good indication that it's not a program that you want to go to. You want to make sure that the residents are happy, getting along, and that's going to affect your experience as well. Other than everything else, you want to make sure that you're going to enjoy your time there and enjoy your time of where you're moving as well. So you want to ask them questions like that. What kind of things are they to do here in the city? And, you know, if it's a really adventurous hiking type of town, you want to make sure you're ready for that. Or if it's very metropolitan town, you like that.
Right.
And what's the cost of living like? And,
right.
You know, do you guys share apartments? Like that.
Yeah, so it sounds like the list for the residents needs to be more directed to and be concerned more about the quality of life and their experiences.
Yeah.
You know, about being on call, where to live, how the residents have as a group, do they socialize, do they hang out? Any electives in the programming, what they like, what they don't like about the curriculum, or what they see.
Exactly, you can definitely ask that.
Yeah. Oh, yeah.
Always ask what they don't like.
Yep.
Because they'll say it.
Oh, yeah.
So a lot of them, they have no reason to hold back. So when you ask them what you don't like about the program, you almost always get a really good answer. So ask them.
Man, this is some good info, Doc. This is some good info. This is good. So let's wrap it up here. There's a couple other questions. Well, two other things I want to ask as it relates to your experience. So you applied to 17 programs, got 13 interviews, went on actually 11 of them, and probably got how many acceptances did you get?
Well, it's put through match, so I'm not really sure.
Oh, that's right. That's right. Well, I'm sure. I mean, I know you professionally too, so I know that you probably had many people ranking you in their top ones or their top pool because I mean, you're just phenomenal person, and also as a resident and as a dentist. So I'm sure if it wasn't match, you probably would have had a lot of those 13 of those programs actually wanting you to be part of their program. So now the question is this: knowing what you know now, and knowing what you've experienced over the last, I guess that was you started maybe in June, you probably went through December, a good 6-month process of the interviews, preparation for PEDO, because you got to keep in mind your PEDO is one of those programs that takes on a lot of applicants. I mean, between PEDO, ortho, and PEDO, ortho, oral surgery, and GPR programs, you're looking at over 10,000 applicants back in 2015-16. I'm reading a survey that's done by the ADA Health Policy Institute on Advanced Dental Education, and PEDO's right up there, 10,700 applicants. Of that, less than 450 people were actually enrolled, and there's 77 programs, PEDO programs. All right, so over 10,000 applicants, less than 450 people enrolled, which is about 4% for 77 PEDO programs, which on average, if you look at the numbers of how many are enrolled and how many programs, you're looking at anywhere from 5 to 6 slots per program. So knowing what you know now about this whole process, what would you do differently, if anything? What would you do differently based on?
I feel like, I feel like I would have, I feel like I started maybe a little bit late in the process. I decided around July, I think, and then didn't actually start getting references until August or so. So I feel like maybe my references didn't have as much time as I would have liked them to have. So I feel like I want to start maybe a little bit earlier with that process. and also just that I would spend a little bit less time more time getting all my documentation together. And then also, if anyone who's applying that's Canadian, make sure that you get your documentation for your visa started as well, because they're going to start asking for that. So match is in January, but then soon after match, they're going to start asking for your documentation. So you want to make sure you start to kind of know how to apply to your visa application and how to do all that actual documentation before as well. And then I wrote the ADAT, but some people who didn't really regretted not writing it. So I'd say that especially going forward, it's almost necessary to write the ADAT. So I feel like it's really important to write that exam because I know one of the programs that I applied to, I had submitted my application just the night before, and the next day by noon I had already received a letter from them saying that they wanted to interview me. It was UT Houston. And when I went there during the interview, they said that the reason why they chose to interview me so quick, they hadn't even read my application yet, was because of my ADAT score. So your ADAT score can go very far.
Wow. So in that particular case, for that particular school, because you had already taken the ADAT, that was a green flag for them. Because I know some programs, because the test was new, some programs made it optional, some made it, made it mandatory. And I'm sure some programs actually probably saw a difference in the number of applications probably last year because of that exam. But for you and for a particular program that you were interested in, that you had applied to, that was a plus for you because you had your ADAC score already, because you took it early, you were granted an interview.
Yeah, exactly. And your ADAT score, writing the ADAT, whether it becomes optional or not in the future, is really important because writing the ADAT shows that you're a little bit more dedicated. So it shows that you spent the extra time to write the exam and set yourself apart. And truly, it is going to be the future. The ADAT will become essential. It's going to become necessary anyway. So I'd say that make sure you write that exam. It's really important, and I feel like it just gives programs the idea that you're a serious candidate and that you're mature enough to spend the additional time to write the exam. So even if a program has it as optional and you do have the exam, it looks a lot better than opposed to having not written the exam just because the program has it as optional. So make sure you write it. Right.
It's almost like I tell people, rather have it and not need it than need it and not have it.
Yeah, exactly. Even if your score isn't the best, it's still better that you wrote it because you're still better than somebody who didn't apply at all and didn't even write it. So your score matters less, but the fact that you wrote it is important.
Right. So just take it. So basically, just take the ADAT. Right. Take it, whether it's required or not. It may give you an advantage in the admissions committee's eyes because it shows that you're dedicated and that you're more serious, that you put additional time aside to do that. In addition to everything else that you're doing clinically at school, your application process, preparing for Part 2 of boards. I mean, there's a lot of exams, and that's why one of the reasons a lot of students are like, oh, God, another exam, but doing it and taking it, there's some upside to it in the eyes of the program director. So that's good. What other?
If you get a good score, then it's
yeah, exactly. What other tips or pearls do you have for us as we close out?
I'd say only apply to programs that you realistically want to go to. I know that some people just apply to a ton of programs just because they're afraid they're not going to get in, but it becomes a tough situation because once you start getting interviews, you might hear, so one program might tell you in October that, hey, we have an interview for you. And then another program that you really want to go to might tell you in November that they have an interview for you, but now your days are full up. So if you're confident enough, you should just apply to programs that you realistically want to go to because sometimes scheduling the interviews can get difficult, and if you've already committed your time to an application or a program that you weren't that interested in, and then now you're just supposed to go to a program that you did want to go to, you're kind of wasting your time. So, often you want to just apply to programs that you actually want to go to rather than just applying to have another number. So you want to make sure that, and also have an answer ready because some programs will ask you how many programs did you apply to and what other programs did you apply to. Know that you don't have to answer that question, so you can kind of give them a generic answer. You don't have to actually tell them which programs you applied to if you don't want to, because that's really none of their business. You can just say to them, you know what, I applied to, my answer was, they asked me which programs did you apply to, or how many programs did you apply to, and I just answered with, politely with, I applied to several programs on the East Coast and West Coast. On the West Coast is where my family is in Canada, so it gives me an opportunity to be closer to that, but then I've also been visiting East Coast, I enjoy living as well. So I applied to programs on both sides just to get a realistic picture and just see sort of geography. You don't have to say I applied to Stop and on. I applied to this program. You don't need to say that.
Right. So could you repeat that? Because I think we lost a little bit of connection. You said sometimes programs may ask you what other programs you've applied to. Could you repeat that for me? How did you answer that question?
Yeah, so I answered because I'm Canadian, so I answered saying that I applied to several programs on both the East Coast and the West Coast. The West Coast is closer to my family in Canada, so that's not reason for me to apply there. And as opposed to the East Coast, I've been living on the East Coast and I enjoy living here. So geographically, I figured that this would be a good area to apply to as well. I didn't mention how many programs I applied to, the names of the programs or anything like that. I feel like it's really not necessary, and I feel like if a program's asking me like that, you can say in general how many programs you applied to, but you really don't have to say names. I feel like it's information that it kind of changes the tone of the interview, and I feel like it's not really providing them with. They don't really need to know that. I just feel like I feel like you can just give them a generic answer. You don't have to say, because maybe you applied to 25 programs and you don't want them to know that you only got 2 interviews. So you don't need to tell them that. Right.
You don't want to stick your foot in your mouth by revealing your trump card, and your trump card could be the fact that you're applying to several programs strategically based on X, Y, and Z. You're right. That may not be any of their business. My focus would be on I apply to programs like yours, but I like yours, and that's why I'm here. And I'm so glad I got the interview.
Yeah, exactly. Like, I'm honored and this and that. You can say stuff like that, but they don't need to know specifics.
Right. I'm not focused on those other programs right now. I'm focused on this one. This is why I'm here. I'm glad to be here, and I would love to be selected.
Right.
Just flip it like that. What other tips? Yeah. What other tips or pearls? Cause you've got some good ones here. What other tips and pearls?
Other tips and pearls for girls, make sure that the day of the interview, because often I had 2-day interviews, so the day before the interview would just be the tour. So bring a pair of flats because they actually sometimes the tours are really broad. Like if they have a huge campus, they have a university campus. So I always brought a pair of flats in my first because there's a lot of walking. So make sure you're ready for that, and then also make sure you make friends with the people who you're interviewing with, because you're going to see the same people come up at different interviews. So I ran into people who are interviewed in Seattle with, in Colorado, and in Texas. So you'll meet the same people. So you want to make sure that you're making friends with them so that you're getting information from them as well. So maybe they know some information that you don't, and that you can kind of talk in between while you're waiting for your interviews and what they know. Maybe they've been interviewed at a program that you're headed to afterwards to give you some information. So make sure you make friends with those people, because you'll see them again, and they might end up in your program. So it's important to make those relationships because you get information.
Right, and that's a good point. Be friendly with others that you're interviewing with, because also I'm sure the program directors or the current residents are looking how you interact or how the group interacts with one another, especially since you guys are going to be doing that as a resident at that program. But also, like you said, because other candidates maybe they've had interviews and been to places where you're getting ready to go, and you might have some dialogue or vice versa. So so that's good. That's good. Oh, wow. All right. Anything else? Any other last pearls? I mean, we got a good list. I've been taking notes since.
There is something, I forgot the name of it. There's a book that one of the pediatric residents told me about. It's an interviewing book. It's called How to Interview. It's for med students, but you can kind of use that as well. I forgot the name of it, but once I get the name of it, I can send you an email. It's a book on Amazon. You get it as an e-read, and it kind of goes over how to interview and what questions to ask, and it's kind of a good refresher and can help make your list of questions.
So that was
once I get the name of that.
So that was a book that was kind of tailored towards medical interviews, but I'm sure it can apply to dental interviews too.
Yes.
Okay. Yes. Yeah. If you can send that to me, what I can do is I'll post that here so that we'll have it on the video and people can go to it. So that book was helpful for you.
Yeah, it was helpful for me. It's a quick read. It's only, I think, like 100 pages or something like that. It's not hard, but it goes over some questions. It goes over some do's and don'ts, and I feel like it's a good little refresher if you haven't interviewed in a while. And then you'll have to cater it towards dentistry and towards your program afterwards. But it's a good little read.
Good. Okay. Well, awesome. Well, you already know, and I'll just say it again. I'm so proud of you. So glad that you decided to do a residency. I hope it's been helpful. It looks like it has, because it's gotten you into pediatric dentistry, but you've also been able to use a lot of the experience and content and the relationships that were formed in the residency here as a GPR resident that gave you the momentum and actually helped with your candidacy and being selected and getting into PEDO. And you're going to the University of Washington in Seattle, correct?
Correct, yeah.
That's awesome. That's awesome. And they take how many residents? You're one of what, 4 or 5?
5.
5. Yep, there you go.
Yeah.
There's that number, that magic number, 5, 6.
Yeah.
So that's great. So hey, so much information, so very helpful. I appreciate you and say thank you for taking out the time, and also just putting together and sharing your experience and applying to PEDO and how you got in. So thank you so much, Dr. Gill.
Yeah, no worries. Thanks, Dr. Hayes.
All right, I'll talk to you soon. Thanks again, and send me that that link about the book on how to interview, that refresher book. That'll be great.
Yeah, sure, no problem.
All right, Doc. Thanks so much. See you soon. Talk to you soon.
Yeah, you too.
All right.
Okay, bye.
Bye-bye. Bye. All right. All right. Hey, so another successful Ask Dr. Darwin. This one is all about how to get into PEDO residency from a perspective of a candidate who actually had 17 programs she applied to, 13 interviews, probably would have gotten into all of them if it wasn't matched, but she found her program and the program found her, and she also has given us a lot of tips and strategies on how to interview, how to go about that day, how to prepare for the application, a lot of good information. I advise you, don't just listen to this video once. Go back, replay it at least two or three times, especially those of you that are interested in PEDO. This is valuable, raw data from the mouths of the residents and the people that are applying, the people that are doing and have done what you're getting ready to do. Replay it 2, 3, 4 times. It's going to be very, very helpful to get you prepared to get into PEDO. Remember, only about 4% of the people that apply to PEDO get in. 77 schools or programs, and they take about 5 or 6 people every year. So I hope this information in this video and the contents of it has been very helpful. Let's get you into PEDO. If you have any more questions or comments or just anything that you want to know about PEDO residency and any other residencies, if we can help you, you ask the questions and we will get them answered. Thanks again. See you soon. Bye.